Hi, my name is Dr. Sridhar Vennamaneni. Today we'll talk about the role of exercise in preventing cancers. For many years, the research has shown that exercise has been shown to prevent risk of breast cancer, uterine cancer, and colon cancer. Since then, we have new data that was recently published in the Journal of American Medical Association, which showed that patients who exercised have significant reduced risk of multiple other cancers, including esophageal cancer, stomach cancers, lung cancer, your liver, kidney cancers, bone cancers, and leukemia. Now, if you look at the etiology of cancers, most of the cancers, there are many causes of cancers. The common ones are smoking is one of the main causes of cancers, followed by obesity, alcoholism, genetics, infections, radiation, and other causes. Now, the reason, when we look at the other causes of cancer include lack of exercise and eating more meats and reducing vegetables and fruits. So when we look at exercise, how does exercise help cancer prevention? The research has shown that exercise reduces inflammation in the body. In addition, there's reduced levels of estrogen and insulin. And based on previous research, we know that increased estrogen can lead to breast cancer and uterine cancer. Also, studies have previously shown that patients who are obese have a higher risk of multiple cancers, including breast cancer, colon cancer, pancreatic cancer, and multiple other cancers. And exercise, in addition to reducing insulin and increasing estrogen levels, also reduces inflammation and increases the immune system's ability to fight inflammation. The next question is, how much exercise do we need to do in general to prevent cancers or heart disease? The studies show that in general, most patients should aim for at least 30 minutes of moderate exercise 5 days a week, at least. The more is better. 30 minutes could include brisk walking, could be jogging, could be treadmill, it could be biking, doing some bicycling or swimming or even dancing. Now, the studies also show that patients who do strength training do better in addition to exercise like walking or jogging. The benefits are greater if you increase the duration of exercise from 30 minutes 5 days a week to 60 minutes 5 days a week. In fact, there's a new study just recently published that showed that patients who exercise more had a significant reduced risk of death, irrespective of whether you have cancer or not. We don't need to exercise 30 minutes at the same time every day. The exercise can be 10 minutes 3 times a day or 5 times a day. At the end of the day, the goal is to do at least 30 minutes 5 days a week. The more, the better. The other benefits of exercise, in cancer patients, studies show that when you exercise, there's reduced risk of anxiety and depression, reduced risk of falls, reduced risk of osteoporosis, and overall quality of life is better in patients who exercise. The studies also show that in patients who have been treated with cancer, those who eat a healthy diet, which includes mostly fruits and vegetables, and reduced consumption of meats, especially red meats, when you eat healthy and you also do the exercise that we just discussed, there's significant reduced risk, almost 20 to 25% reduced risk of breast cancer, prostate cancer, and colon cancer. Our advice in general is that most patients should aim for at least 30 minutes of exercise 5 days a week. Whether you do it at once or whether you do it in 10-minute intervals, it doesn't matter.